Good morning, dear friends. God's blessings of grace and peace to you. I am Dr. Julius Kwedi, cardiovascular surgeon, coming to you from Moscow, Russia. Now, today I'm presenting to you a curious case of acute limb ischemia. 65-year-old female presented to our casualty department with signs of acute limb ischemia, pulselessness, pale, paresthesia, paresis of the right limb. We did a CT scan, ultrasound. We also did chest x-ray and blood workup. On CT scan, this is what we found. So the patient is complaining of right lower limb, acute limb ischemia, right? She's been at home for 3 days. When the episode first began, she did not go to the hospital, and then she eventually came 2 days later. And upon chest x-ray, so now we are looking at the CT scan from the thoracic all the way up to the lower limbs. Okay, we can see from the thoracic area here that our aorta is pretty much intact. There are some calcific changes, but nothing much to worry about. The celiac superior. Now look at that. This celiac, the celiac trunk is not stenosed or occluded. The superficial, the superior mesenteric artery is also intact. However, you can see already we are beginning to see some atherosclerotic calcific changes. You can see some atherosclerotic changes of the aorta. As we go down, we see here we have our left renal vein. Our left renal vein coming from the left renal, from the left kidney all the way into the inferior vena cava. And as we go down, you can see still the atherosclerotic changes in the posterior wall of the abdominal aorta. You can see the superior mesenteric artery here going down right anterior to the left renal vein. And then we have the left and right renal arteries being given off. And then you can see some atherosclerotic changes as if impinging on the right renal artery, but nothing suggesting chronic, nothing there suggesting of acute kidney injury as of now. Now we continue with our posterior, our examination. You can see here the atherosclerotic changes, atherosclerotic changes of the infrarenal aorta, extrarenal as well as infrarenal aorta, but there is no hemodynamically significant occlusion or stenosis, and it's quite marked. It's quite marked. Atherosclerotic changes of the infrarenal aorta, and then here, and then you begin to see that it's supposed to give off the inferior mesenteric artery, and you can see the inferior mesenteric artery finally being given off right here, and you have your inferior vena cava right in the right lateral posterolateral position at 7 o'clock from the aorta, and there the inferior mesenteric artery continues coursing down. And then as we continue, of course these are the pneumatosis intestinale and such. Now, and then you have your sacral branch being given. No, these are your vertebral branches that are given off from the aorta. But this is not just the posterior This is not just another vertebral branch. This is the coccygeal branch that is given off right before the bifurcation of the aorta into the right and left iliac arteries. Then the right and left iliac arteries, you can see they continue coursing and meandering right there, and then the right common iliac artery gives off the internal iliac artery giving off the internal iliac artery as well as the external, and then you have your right iliac vein right behind there. The left does the same, gives off the external iliac artery and the internal iliac arteries, and you continue with your external iliac arteries that then end up feeding into the common femoral arteries. So, and up to here, the iliac arteries are pretty much satisfactory. They are pretty much clean, as well as the common femoral artery. It also looks fine to me. And then the left common femoral artery gives off your deep femoral artery and your superficial femoral artery. The left also does the same, but now look at this. The left, when the common femoral artery at the bifurcation here, as soon as it gives off the deep femoral artery, and then you see whoop, occlusion of the superficial femoral artery right from the mouth of the bifurcation. All right, so this now tells us the reason. This is now the lesion that is plaguing this limb. So as you continue with this occlusion, now look at that. The deep femoral artery eventually gives off a branch, right? You can see it gives us a branch here. It gives off collaterals, right, that continue to cause the common femoral artery here. Not only is it occluded, but it's also enlarged. So there is also aneurysmatic changes of the common of the superficial femoral artery on the right. Now on the left, you see the deep femoral artery continues here, giving off branches as it courses down. And then all of a sudden, look at that. The superficial femoral artery on the left also eventually is dilated. Not occluded like it is on the right, but it is dilated. So that means even on the left, you have aneurysmatic changes. But look at that, then wow. Occlusion of the superficial femoral artery on the left as well. So now we have bilateral occlusion of the superficial femoral artery on both legs, right? And you can see the bilateral occlusion continues on the left and on the right. And look at that. Look at that giant superficial femoral artery. And not only on the right, but look at the left as well. The left too is occluded and aneurysmatic. So as you can see, it continues. Very ginormous aneurysms on the left and the right that go all the way up to the popliteal, into the infrapopliteal region, right? So you have aneurysmatic changes of the superficial as well as the popliteal arteries of the superficial femoral artery as well as the popliteal arteries. And they are totally occluded. They are both totally occluded. And so these legs are living on collaterals. They are living on collaterals. And then, lo and behold, on the left, look at that. The popliteal artery eventually gives off this branch. You can see this branch here. It gives off the anterior tibial artery, right? And then you have the tibioperoneal trunk, which then gives off your peroneal artery as well as the as well as the posterior, tibial artery. But the occlusive changes continue with the peroneal artery as well as the posterior tibial artery. Now, the same on the right, immediately after the aneurysmatic dilation. After the aneurysmatic dilation, come on. And so this patient, owing to the, all right, I'll say that later. So you have the aneurysmatic changes there, and then you have your anterior and anterior tibial artery, your posterior tibial artery. All right, so the occlusive changes continue even in the anterior tibial artery on the right, as well as the peroneal artery on the right, and as well as the posterior tibial artery on the right. So we rushed this patient to the theater, and we did a femorodistal popliteal shunting with autovenous transplantation. So we harvested a vein from her right, the great saphenous vein. We harvested the great saphenous vein from the right, and we also harvested a great saphenous vein from the left. Yes, we also harvested from the left, and then we anastomosed the two and shunted all the way from the 3 centimeters below the bifurcation of the superficial femoral artery. So 3 centimeters after the bifurcation of the common femoral artery into the superficial and deep femoral arteries, we transected the superficial femoral artery. We transected the superficial femoral artery, and then we sutured. We did an anastomosis of the graft and the superficial femoral artery, and then we tunneled that all the way until the distal part of the popliteal artery. Yes, so we did a Femoro-Popliteal, Femoro-Popliteal shunt. Now, on the left, we did not touch her left leg. The right leg is the one that presented with acute limb ischemia. The left leg is at Nasitana, relatively stable. The left leg is relatively stable, and therefore we do not touch it. And we'll see until next time when the left leg begins to act up. All right, so that is it for now. Thank you for... So the patient is in stable condition. That was last week Friday. So that was 1 week ago when we operated on her. Until now, she is stable. So thank you very much for tuning into this episode. May the Lord bless you and keep you guys sane in this insane world. And see you in the next video. Shalom.